Happy Friday, everybody, and welcome to everybody's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, the vampire breast lift. Spoiler alert, don't waste your money. And then, do-it-yourself home Botox. Is this a good idea? We're going to talk about it. And then finally, Sono Bello and other plastic surgery chains are under fire. We're going to give you all the details, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button and turn on those notifications. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me is Sarah.
Hi.
Hello, Sarah. How are you today?
I'm good.
Doing good. Great. In the box, we got Brenna. Hello, Brenna. Are you there?
I am. Hello.
Sorry, I didn't mean to catch you off guard, Brenna.
No, you're good.
Yeah, you guys doing good today?
Yeah.
Yeah.
Well,
Happy Friday.
Yes.
Nice and
long
cool
weekend.
today. It is a long
Yeah.
weekend.
Long weekend and it's...
I'm on call this weekend, but as of right now, I don't have anything scheduled, so we'll see.
Sucks.
Someone's got to take call on the holidays, so it usually falls to me. But Sarah, you're going to be proud of me.
You ran?
I did, but not only that, yes, that is correct. How'd you know? You're so smart. So I knew I had stuff going on tonight, and so I had surgery this morning, and I had like an hour break, and I went home and I ran 4 miles, and then showered and came here.
Dang.
Yeah, right?
Productive.
Not bad. I usually never do stuff like that.
Are you eating enough protein?
I do.
Sir?
I do eat pretty good protein. I actually eat pretty well, honestly. I eat healthy. I eat a lot of deli sandwiches because they're cheap, and I feel like that's healthy. It seems like it's healthy. And
I don't know. Have you ever tracked your protein intake since?
No, but right now I'm not like really lifting weights. I'm just running. So like when I start lifting weights, which I think I'm going to get back in here pretty soon because I used to really be into that, then I'll start tracking my protein intake. But as of right now, I'm just eating healthy and make sure I'm hydrated. But I'm actually running in a competitive 5K next week, the Katy Trail 5K.
Oh, that's cool.
Yeah, I write for the paper for the Katy Trail weekly.
Okay.
And so they're like, can you come down for our after party? I was like, oh shoot, I'll run the 5K. So.
That's cool.
Yeah,
That'll be fun.
I don't know how well I'll do. I'm going to try to shoot for like 8 minutes or less pace, but I don't know. We'll see.
I would be walking. I am not a runner.
I'm not in bad shape. Like I think of right now, like the fastest 5K I've run in training is like 8.5. But like I always do better in a race scenario because like having all the people there, like just
Adrenaline and
yeah,
stuff.
right.
Yeah.
I always do better in races. So, but I'm actually, and this is just for fun. I'm working up to the, I'm doing the Dallas marathons.
Yeah.
The half, not the full. Anyway, but I thought you'd be proud of me because I actually worked out in the middle of the day, which I never do.
It's better than me. I usually have to work out at the end of the day.
I usually do too. I always do it at the end of the day. I don't like to get up early and work out, but I'm gonna have to start doing it because it's starting to get dark
I'm
sooner.
the same way.
You work out at the end of the day or the beginning?
And I wish it was beginning, but I can't get up early.
I can't either.
Yeah.
I cannot get up early to work out, but I think I may have to because it starts to get dark earlier. I got to keep my runs up, so I may have to actually get up and run early, which...
Yeah, I'm trying to do 75 hard right now, Sarah.
You're trying to do what?
75 hard, but it's more like 75 soft because I haven't been able to do 2 45-minute workouts while
Wait, what's
working.
all right? What's 75 hard?
It's like a fitness and a nutrition challenge.
Yeah.
Oh, okay.
I've never done it because I do not have that much
Discipline.
I don't know
Yeah.
if it's discipline, but like I just don't like.
It's a lot.
I don't like confinement.
Yeah.
Oh, right.
I
Being
don't.
restricted. Yeah.
I like it makes me like
Yeah.
get anxiety and like freak out.
Really?
Like almost like claustrophobic, but like mentally.
Oh, really?
Like whenever I have too many rules that I have to
yeah.
follow, I'm like,
Yeah,
I
totally.
just
I don't like challenges or like trying to be coerced into doing something. Like that's the opposite way to get me to do anything is to tell me I have to do it. So like I'm out. All those challenges.
Yeah.
I don't think I've ever done any of those challenges ever.
I've tried to do like strict diets before, like
Yeah.
super low carb.
Yeah, forget
it
that.
works. Like I've lost a bunch of weight, but it's like
It stresses you.
it's hard to do it.
Is it?
You have to
Yeah.
really be like want it. You have to really want it that bad.
Yeah, I just like to do my own thing, man. Like I will say, and this is like the first time I've ever even done this. I have been using AI to like help me with my runs.
Yeah,
I mean, it's super smart.
I use AI like almost like a personal trainer.
Yeah, I haven't made like a
Talk to
custom AI for like training yet, but I've been thinking about it. I have like one where I've been using the same chat thread, and I put my runs in it, and it analyzes like my heart rate, my pace, and then.
Do you have like a little
I have an
monitor?
Apple Watch. Apple Watch, yeah.
Oh, okay.
I only wear it when I work out. That's
I
it.
use an Aura ring. I don't know if y'all
My
heard of
friends
that.
There's a
have that.
ring that's like
Yeah.
a Fitbit thing.
It looks
You like put it on your
this.
pointer finger, yeah.
They
Really?
have different colors, but yeah, it has like an app and you track.
And it synced to your
and you sleep
iPhone?
with it. Yeah, well, yeah, you track it through the app, and you only have to charge it for like 30 minutes every like 6 days.
Have you ever had the
Really?
Whoop? Have you ever had a Whoop? Is it?
Just-
I wonder if it's more comfortable.
I like it.
My
It's very
friend
slick.
Catherine
I have the
has-
newest one.
Has the Aura ring, and she really
Damn,
likes
you
it.
guys like, I appreciate you guys keeping me up to date on technology. I was like, oh, I have an Apple Watch. I'm up to speed on everything. And like, nope.
You're like
It counts your stress level. So I'll be at work and I get home and it's like, you had a really stressful day today. Time to like wind down.
Gosh,
Time to have a drink.
See, I'm scared
Crack
to have.
open the wine.
Right, right.
That's what I'm scared of. It's gonna tell me I'm like stressed out every day.
Oh man, I'm glad you guys are here to keep me up. I feel like I'm pretty good on tech, and then suddenly you guys pull out something and I have no idea what you're talking about. But that's why I love both you guys,
Oh, thank you.
keeping me up to speed. All right, let's talk about some cool stuff.
Okay.
We have some good topics today. All right, so this first segment comes from a phone call I got this week in my office. A patient inquiring about a procedure that I didn't really know was a thing. So this is a segment about the vampire breast lift, and spoiler alert, don't waste your money on this, but I am going to like go over all the...
Injecting blood into your boobs.
Yes, ma'am. I had no idea this was a thing. Yeah, crazy, right? Now,
Like-
we
is it
ta-
like plasma or something?
It is, exactly right. Yeah, it's PRP, platelet-rich plasma. We actually did a vampire facelift segment, I think, a year or so, didn't we?
I've heard you talk about vampire things.
Yeah, so this is the same thing. So, basically this is injection of platelet-rich plasma, which is gotten from your own blood. So they harvest your blood, they put it in a centrifuge, and when you centrifuge blood, it separates into 3 components. It's the PRP, platelet-rich plasma, white blood cells and red blood cells. And so the PRP has like all these growth factors and cytokines and all this stuff, which is supposed to really kind of augment your tissues. And so this PRP injection is kind of a big thing now. And it started out, I think, first with orthopedic guys injecting joints. And I've talked to some of the orthopedic guys, and they say, yeah, it's helpful. It helps rebuild. If you have like a knee that's been injured chronically, and you inject the PRP in there, and people feel better. I mean, I don't think it's like a miracle cure, but they say that it's pretty good. Well, then people started thinking, oh, well, I can inject this into my face to make my face better. So the vampire facelift became a thing, which I've never been really impressed with that. And then now there's the vampire breast lift. So the claims of the vampire breast lift: minimally invasive. Okay, sure. It's a small needle injection. No downtime. Okay. Improve look, feel, and fullness of the skin and soft tissue in the cleavage area. I don't know about that. And restore of sensation to the nipple areolar complex if you've lost sensation. So that's what they're claiming. And of course, the places that are pushing this are like, oh, breast lifts are so painful and they're so dangerous. And breast lifts like one of the most popular plastic surgeries out there right now. I do tons of them. And also these sites are claiming that this is a lot of the sites that I looked at in the last couple of days when I was researching, they're saying this is FDA approved. Okay, that's false. The equipment for harvesting PRP is FDA approved, but there is no FDA approval for using this for aesthetics.
Okay.
Such as facelift, breast lift. So it's that slimy, smarmy,
It just
aesthetic
sounds cool.
game of like saying something is certified or approved, and it's not really, but what they're saying, oh well, we didn't mean the procedure, we meant the equipment, it's FDA approved, but they don't say that.
Ooh.
So the other thing I found too, because I had to learn about this. I mean, I knew exactly what it was when my office asked me about it. I was like, oh yeah, it's going to be PRP. But one of the things I found when I was researching it is a lot of times they will combine the PRP with filler injections. So just like the fillers you get in your face, they're doing fillers with the PRP, which it's kind of cheating, right? Because if I inject fillers into your breast, I mean, you are going to see that.
Yeah.
I mean, there's going to be a difference. Now, granted, it's not a lot. I mean, fillers are expensive, so you're not going to use filler to do a breast augmentation. But I mean, if you inject a little bit of filler in there, it's probably going to be noticeable. And it's kind of a trick, right?
Yeah, because filler works, but you're not really sure. We're not really 100% positive that the PRP works.
Exactly.
Right?
So I think what they're doing is they're adding a little bit of filler so people see a difference in their breast, and they're saying, oh, look what the PRP did. Well, it's not a PRP. So the cost of this, get a load of this, $2,000 to $3,000 per treatment.
You might as well just get a boob job.
I mean, okay, a breast lift nowadays is probably, at least for me where I'm at, I think it's around 7 or 8. All in though, I mean, that's everything. Anesthesia, facility, surgeon fee and everything. But yeah, right. I mean if you're doing multiple treatments, yeah, exactly. Now here's something that's really kind of telling is who is offering this. So I went and I looked up vampire breast lift, who's offering this. It's not plastic surgeons, that's for sure. I found an internal medicine doctor offering PRP breast lift and an OBGYN, and it's most of these med spa type places. But, I mean, that should tell you something right there. I mean, who in their right mind is going to go to an internal medicine doctor for aesthetics? Yeah. I mean, what do they know about aesthetics? Absolutely nothing.
They know how to treat a cold.
Exactly, and so, I mean, that kind of gives you an idea of how serious this is. And further, there's no medical research whatsoever to back this up. There's research about PRP, but it's mostly, animal models.
For injury treatment. Isn't it for mostly injury treatment?
Correct, yeah. Most of the data is going to be on injury treatment. So to my knowledge, there's no aesthetic PRP studies out there.
I think it's just something that sounds cool and they're just trying to market it.
Of course.
The best they can.
Yeah.
And they're like, ooh, it's not plastic surgery, kind of. And it sounds cool.
Yeah, well, and and PRP is hot. I mean, people have been talking about it for years, and they're like, oh, now you can get PRP in your breasts. And so...
Yeah, to make it not sound as plasticky.
Right, or, as invasive as surgery. Yeah, I get it. And so, all right, so the results. So I went and I looked at a bunch of before and afters, and I swear to God, I could barely tell the difference from the before and the after. The only difference I could tell, and it wasn't any lifting, there were a couple of the patients where I was like, yeah, maybe the after is slightly larger, but that's not the PRP. I mean, the PRP doesn't have enough volume to cause any type of augmentation whatsoever. So I would reasonably assume that the patients that they look slightly larger, that they probably got some filler, which I don't think putting filler in the breast is a good idea. It's kind of a dumb idea.
How long does that last?
A year.
Ooh.
Right? Yeah. I mean, so it's like, why'd you do that?
Would you just
but I'm going to let you guys be the judge. I actually pulled some befores and afters off various pages of these vampire breast lifts. Okay. Vampire breast lift number 1. What do you guys think?
It's like a slight difference.
And how?
They just don't, it looks a little bit more perkier.
Yeah, you do think it looks perkier?
Yeah.
I think it looks slightly bigger. I mean, there's still I
don't think it looks very much bigger. I think it just looks a little perkier.
You think so?
Yeah.
Okay, well, I mean,
the only reason I can tell is on the inside part, on the before, it's a little bit flatter, and then on the right side, it's a little bit fuller. On the inside cleavage.
I don't know.
Not on the, I'm not looking very much on the side boob. I guess the side boob kind of looks a little bit bigger.
To me, the shape and the fall of them is the same. I mean, to me. Now, I think
the shape is still there. I just think they look like a little bit more inflamed.
They look a little fuller to me. And I will say, it would be interesting to know when they took this picture. If they took it right after they injected or the day after, they're going to be swollen. You can't stick your tissues without getting a little bit.
I think it was a different day because that lighting is completely
slightly different.
Yeah.
Yeah. I don't know. I don't see $2,000 to $3,000 worth of difference there.
Their skin color looks different too. No, I wouldn't pay $3,000 for that.
No, I wouldn't.
I would just go can't you get kind of a little bit of a lift if you do some Exercise?
No, not really. Not for your breasts. That would be nice.
Just a little
I mean,
bit.
to me, it looks slightly bigger. And again, the PRP is not going to make them bigger. That's going to be, they probably injected filler because
Well,
I think.
the thing is that this lady is going to have to go, like a year or so after, she's going to have to go do this again if she wants
Right, yeah.
that same result.
Well, and if you add,
by that time, it's like you might as well just get.
yeah.
a
And if
boob
you
job.
add filler to it, those prices I quote were just for the PRP. That's not for filler's expensive. Adding filler is, that's going to add another $1,000, $2,000 to it easily. All right, let's see the next one.
Yeah, you can see a difference. Looks like she lost weight though too.
I mean, to me, it looks smaller.
Yeah, they're not as saggy, but it looks like she lost weight.
It does look like she lost weight a little bit.
And so she would lose fat from her boobs.
They look deflated to me.
Well, they look deflated at the beginning though too.
I mean, they look more deflated to me after.
Oh.
I would never post this as a before and after as a way to try to convince somebody to do something.
No, I think she lost weight
Yeah, right.
and that, I don't know.
I do think she lost weight. If you look at the shadowing on her lower abdomen,
Yeah, you can
see
see
that
Yeah,
that she has lost weight,
yeah.
which really
And the side boob fat situation is not the same.
yeah, it looks like she lost a bunch of weight. I mean, so that's like you can't. I mean, I don't know what they're trying to show there. I don't see it. All right, let's see the last
Or
one.
the comment should be, "What's this for?"
I mean, that one to me almost looks like the same picture. I know it's not because
I agree.
It looks like an after, like immediately after. The only part that looks different is not even the boob part. It's like the top part looks
Yeah.
like red and inflamed.
it does. I agree. It looks like they did that maybe the day after.
Yeah, it looks like it's all like on her actual chest,
Yeah, it doesn't.
not her breast.
I bet that one had to be a day after photo because you're right. It looks like it's a little bit inflamed, and so they probably do these pictures pretty soon after when the breast is still a little bit swollen.
Yeah, I see the same blanket at the bottom of it, the bottom right.
Yeah, yeah, it has the same blue.
Maybe
like,
it was the
surgical
same day.
blanket. Yeah,
It could have been the same day.
yeah, it could have just been an immediate before and after.
Yeah, I don't know. I mean, I'll give anything the benefit of the doubt, but I mean,
I don't think this procedure is worth $3,000, and I don't think it's worth me showing my boobs to somebody. That's what I don't think. Like, this girl is like, yeah, here's $3,000. Also, take a picture of my boobs
yeah.
and put it on your website. I would never. If you're gonna put my boobs on a website, they better look good.
Oh my gosh, Sarah.
I mean,
I agree with you. I just don't see it. For me, I think this is kind of a scam. It's using technology that's out there that has some data to show that the technology is helpful in one application, and then you're applying it to something totally different and trying to convince people that they should do this. So, and another thing too, I mean, there's no plastic surgeons, I think, that are offering this. I mean, the people who know aesthetics, and we offer a lot of non-surgical treatments. We do. I mean,
Yeah.
I'm more than happy for someone to get the result that they want non-surgically, if that can be done. But I just don't see it with this. And, it's not FDA approved. The people that are offering it are not experts in aesthetics at all. I think I think people should steer far. I don't think it's dangerous. That's the only positive thing I can say about it.
Yeah.
That's
just not very effective.
Yeah, it's just not effective. I don't think it's dangerous. I mean, like some of the other things we're going to talk about later in today's show. But on the other hand, I just don't see. I look at the befores and afters, and maybe they're slightly larger, but that could be either filler or they just took the picture right after they injected them, like we thought on the last one.
Yeah.
But I mean, I recommend people steer away from this one.
Me too.
I just think that it's a waste of money. Yeah. So, all right, here I'm gonna recap this, Brennan, real quick. So today we were talking about the vampire breast lift. I didn't know this was a thing, but somebody called my office asking about it, so I had to look it up. I knew what it was going to be. It's platelet-rich plasma injections in your breast, and PRP is a thing, mostly used for joints to improve the overall health of maybe a chronically damaged joint, where there is some data to show that it's effective. And of course, some people have jumped on that technology to say that it's great for doing a non-surgical facelift, which I don't really believe that works, and now a breast lift. And the only positive thing I can say about the vampire breast lift is that it's probably not harmful to you. But today we looked at some befores and afters in our segment, and we just really did not see much of a difference. And this procedure will cost you $2,000 to $3,000 per session. And this is not an FDA-approved treatment. And when you look and see who's offering this, the doctors I found were internal medicine doctors, OBGYNs, people who really don't know anything about aesthetics. So yeah, I think that the vampire breast lift is kind of a scam, and I would advise you not to waste your money. So there you go. All right.
I would not do that.
Yeah, I think that's a hard pass. Okay. Okay, ladies who are on social media, probably more than I am, although maybe not. Have you heard of the do-it-at-home Botox?
No, but I'm not surprised.
Britta, do it.
I have, but I haven't seen anything of it. I've just heard of it.
Okay, all right. Well, today we are going to do a segment on the dangers of do-it-yourself home Botox. I couldn't really believe that this was a thing, but somebody sent me an article about it, and it really is a thing. So yeah, do-it-yourself Botox. New trend on TikTok and social media. What could go wrong injecting a powerful neurotoxin into your own face? Sounds pretty safe, right?
Yeah. One time this, it's like, I could see that happening because one time this company, like back in the day when I was more on social media, they were like, hey, can you do a video or whatever about this product? And it was like this serum that came in this little thing. And it had little needles in it, and you would prick your face.
Okay.
Where like you wanted to see
you
results.
didn't do that, did you?
Yeah, I did it.
Oh, you did it?
Yeah.
And?
It was weird. It felt like you were just like putting Velcro, like.
Did you see any
really
difference?
Pokey Velcro. No, not really, but I only did it once just for that video because I just don't. It was a lot of work and it freaked me out because I was putting needles on my face.
Yeah, I mean, injecting your own face with needles is that's pushing the limits.
Yeah.
So, and people do this because it is dirt cheap. I mean, that's
always good for needles on your
right,
face.
yeah. That's always the best medical products, are the ones that are the most cheap.
Dirt cheap.
So there was a TikTok video, I guess, floating around. Actually, I clipped part of it, so let's watch that TikTok video. Brenna, throw it up there.
Okay, so here's your long-awaited Botox, Inotox update. I got Inotox 100 units from Celamade.co. There's lots of creators on here that have coupon codes for 15% off. I just recorded this whole video that was like 6 minutes long and it just disappeared. So anyways, I'd already drew it up on my face. So I did 2 units, 2 units, 2 units, 2 units, 2 units, 2 units, 2 units. On your forehead up here, very shallow. You just go in very, very shallow. Use an insulin needle. You can get those off of Celamade too, or I got mine off like a pack of 30 for like $7 off Amazon. Then if you want to do I think this is the glabella, you got to go 4 units here, 4 units here, 4 units here, 4 units, 4 units. And you just hold, this is a pretty deep one, and then these I went in at an angle, not too deep. And then if you want your brow lift, you do 2 units just right here, superficially under the brow. And then I did 3 injections of 2 units apiece, right around my eye for crow's feet. And those are very shallow as well. Again, I am not a professional, but you guys were asking me, so I'm telling you what I did.
She seems like she goes to get Botox a lot.
I am not a professional. I mean, even her technique that she was describing is not really accurate. So, there's a few of these products out there. The one that she's mentioning is Inotox, Inotox.
Is that like a fake Botox?
It's actually, I mean, it's a Botox clone. It is
so
actually.
it's not as like potent. maybe.
I think that it's allegedly supposed to be pretty similar in its potency. It's made out of South Korea.
Okay.
It is a botulinum toxin, so it's not. Yeah, there we go.
What's that other Botox? That's not Botox.
So there is Dysport. Is probably
Dysport.
Yeah, we actually have. I don't know why, but the girls in the office want to get Dysport. I guess because people ask for it. So we do offer Dysport, which that's a legit botulinum toxin. And there's Xeomin is the other one. I used that one. I didn't really love it, but I didn't use it very long. There's one more too. I can't remember the name of it. I just like Botox because it's got brand name recognition.
Yeah, it's trusted.
Yeah, it's trusted. Yeah, it's been around forever.
We have a comment, but it's about the last segment.
Oh, okay.
Is that okay?
Yeah, sure, absolutely.
Robert said, what about stem cell for plastic surgery or enhancement? Is that the same as this dumb vampire thing?
I would assume that, I would lump all those in like PRP and stem cells. But I mean, I don't think that anyone's doing
I saw the Kardashians advertise for stem cell stuff.
Stem cell for rejuvenation?
For like stuff like that, yeah.
Oh, really?
A recent post. I think it was on like Chloe's.
Oh, I'll have to look for it. I mean, there's all kinds of stuff
And they
out
had,
there.
like, a vial
It's not
with,
something that's like mainstream for sure.
No, it's for the top 1% people.
You're right. So yeah, who knows?
Not for us hobos over here.
I know, us poors, yeah.
Us pores.
I'll look into that, but I'm not sure that that's really like a really popular thing.
Yeah.
All right, so Initox. Initox is this Botox clone out of South Korea. It's approved in Korea, but it's not approved in the United States. It does not have FDA approval, which, I mean, that's one of my potential issues with this. Anything that's not FDA approved, especially coming out of another country. I mean, I know South Korea is pretty first world, but I mean, there's not as much regulation. So things you have to like be worried about are potential contaminants, infection risk, like the potency.
And like what website you're getting it from?
Yeah, that too. I mean, you don't know if you're getting like a fabricated product or the original. I mean, anything you're ordering something from out of the country, it's just a little bit, potentially sketchy. It is cheap. Botox in the United States generally runs you, like on average, about $10 a unit. This stuff is dirt cheap. It's like $1 a unit. Like it's like 10% of the price.
Nice.
Yeah, really cheap. And it's, it's convenient if you're going to do it yourself. You don't have to make an appointment. But is it safe? Well, no. There's just no way that I can advocate that a person injecting themselves with a potentially lethal neurotoxin is safe if they don't have training. I mean, if I was going to get Botox, I wouldn't inject myself. I just wouldn't. I mean, it's much easier to inject someone else. And so as somebody who's been literally doing Botox for 20 years, if I was going to get Botox, I wouldn't inject myself because I would not feel that was like the smartest thing to do.
Yeah.
And I have 20 years experience doing it.
I wouldn't do it.
Yeah, I mean, right off the bat, I mean, it just sounds like a bad idea. Plus these people, are not trained.
Yeah.
There is the issue of the non-FDA approval, and so, I mean, it is, it's possible that they could have contaminant risk, infection risk, if, like, say, the vial potency was 10 times higher or something. I mean, things like that can happen if it's not regulated. So then, you could get into real trouble if you get like a hot vial and you're not injecting it properly. I mean, you could literally kill yourself. I mean, botulinum toxin is deadly.
Yeah, that's crazy.
And people that have been doing this for years have potentially have problems. I mean, I know injectors that have been doing this a long time, and they're not doing it on themselves, they're doing it on someone else, and then they have an issue, and someone gets a complication. I mean, it happens.
Yeah. Give me a little history lesson. Where did Botox come from? Like what doctor was like, I'm going to inject this into somebody's forehead and it's going to get rid of their wrinkles?
I've looked that up. It's been around for a long time. I want to say it was the 90s when they first started using it for paralysis. And I want to say that it was first used for medical uses like spasticity.
Yeah, I'm sure. But I wonder what doctor was like, hey.
Well, they figured out that if you don't inject it into your bloodstream, that it doesn't really go anywhere.
Yeah.
If you inject it into a muscle, it tends to stay there. And so you can inject this potent neurotoxin. Because obviously, if the neurotoxin gets in your bloodstream and it goes to, say your diaphragm,
It make you stop breathing.
yeah, you'll stop breathing. And in fact, when we were talking about those fake Botoxes that were, leaking into the United States, there were reports of people that were having to go on ventilators because they lost their ability to breathe. And we kind of postulated that was because the vials were hot, meaning instead of 100 units, it was 1,000. And then, it's when you're injecting super high doses, it's more likely that it can, get into your bloodstream. And there have been reported deaths from medical use of Botox. And the reason for that is because, when you're injecting bigger doses into deeper areas, there's more risk that you actually cannulate a blood vessel and then hit the vial, right?
Yeah.
Versus in your face, the blood vessels are so tiny that, if you do hit a blood vessel with a needle, the needle just tears right through it, and you're not like injecting into it like an IV.
Yeah.
Right? So, at the end of the day, Botox is potentially deadly. And to have somebody with no training injecting a deadly substance.
I need to get more deadly substance in my forehead, speaking of.
Oh, anytime. I won't make you do it yourself. I'll be
Thank
happy.
you.
I'll be happy to do it for you. But yeah, the risks are, the more realistic risks are you either inject it and it doesn't work because you don't know where to inject. That girl was saying you inject shallow. You don't want to inject shallow, you want to inject into the muscle. If you inject too shallow, then you're going to get a partial result or no result at all. I can tell when I'm putting a needle in someone's face, I can feel the difference between skin, fat, muscle, and then bone. And so just for years of experience, I can put that needle right where it needs to go, get a super smooth result. People who have never done this before are not going to have any idea. They'll be lucky to know where to put it in their face to actually hit the muscle.
Yeah.
Because you do have to have some knowledge of anatomy.
She's saying you inject it with an insulin needle, and insulin needles are very small.
So that's correct, but even that's wrong because although I do use an insulin needle to inject, I don't draw with it. If you draw it up with the insulin needle, the mere act of putting that insulin needle into a vial dulls it. And then it makes the whole process worse. So even what she was saying, basically I have issues with everything she said.
Yeah.
She did get the right locations, although when she was doing her corrugators, which are these right here in the glabella area, where she put was way too low. If you inject too much that low, it'll get into your eyelid and then you'll get a droopy eye.
Yeah.
So, just everything about what she said was basically wrong. And so, again, if this was something where it's, not potentially deadly, I might be a little bit more, lenient on it. But, this is a potentially deadly substance. More likely what would happen is somebody would inject incorrectly and get a facial paralysis. Because that is a thing. I personally have never had one, knock on wood. I've never had somebody get a facial paralysis because I'm just very...
How long do those last?
The length of the Botox. So 4 to 6 months.
Ooh.
Yeah, you could get a droopy eye, it look like you've had a stroke, a droopy mouth. That video went on and said she was injecting it around her mouth. I was just like, oh my God, I don't even inject around people's mouths because I just don't want to take the risk that they get a, hey, how's it going?
Oh Lord.
Kind of thing. Just everything about this to me is just too risky. I get that it's cheap. I know that money is a big issue for people, but if the potential risk is death, I just think that there's a point where you say, okay, it's not worth it. Or if you get a facial paralysis.
Yeah, this isn't an at-home procedure.
No, and it's not like it's super complicated, but again, I've worked with a lot of injectors over the years, and even people that have been doing this a long time, occasionally have issues. Not all the time or commonly, but it does happen. And so if you have zero experience doing this and you're using a product that's basically not FDA regulated that you got from some other country's website, it just is a recipe for problems.
Yeah. Do they still have Botox parties where doctors come to your house
Yeah,
and do that?
so.
I didn't know if that was
it's hard to get
allowed anymore.
No, you can do it. I don't do that anymore. I did that when I was young, when I was fresh out of training, because you'll do anything to get patients, right?
Yeah.
I think that some of the injectors occasionally still do them.
Yeah.
It is still a thing.
It's just a way for them to get it. It's almost like if somebody buys something wholesale because there's all these women.
Right. Yeah. You do.
So it's a little cheaper sometimes.
Yeah. You get a discount. Normally what happens is the person that set it up gets their Botox for free.
Yeah,
and then everyone else pays regular price.
that makes sense.
So-
But I mean, that's a way to get at-home Botox for a little bit.
Right.
cheaper.
Yeah. I mean, I get
Instead
that.
of
I get that
buying it from
Botox
South
expensive, and
Korea.
and some people might be like, "Oh, of course, this guy's going to say this is a bad idea because he wants to make money." I mean, we don't make any money on Botox.
Really?
I mean, we technically do, but it's not worth enough for me to go out there and say that something is a bad idea if it wasn't really a bad idea. We just offer Botox because people expect you to offer Botox. From a pure dollars and cents standpoint, Botox is not a big moneymaker.
Yeah,
you
but
know.
it's effective.
It's effective. No, it's great. It's
And
a great.
I feel like that's like, to me, I feel like Botox is like that. Like it's that first procedure that maybe gets them to like trust you with more stuff.
100%. Yeah, because people get Botox and they're like, oh, what else you got?
We got
And then-
lasers.
We got lasers. We got fillers. I mean, fillers and lasers actually have a pretty good, ROI. Botox, not so much. There's just too much competition.
Yeah.
I mean, you can get Botox practically at the gas station down the road. I mean, everyone and their grandmother's injecting Botox because the laws are so loose on
We
who
won't
can
be going
inject
to the gas station though.
gas station Botox.
No.
You wouldn't do that. What about gas station plastic surgery? Drive-through? No. Okay, good. You have been.
That's here?
No, I'm just messing with you.
It's in South Korea then, maybe.
maybe so, maybe so.
You're
All
like,
right,
recline.
Brenda, let's recap
Get in
this.
there.
Today we were talking about a new trend that I didn't know existed, which is at-home, do-it-yourself Botox clones. Inatox is the most popular one. This is a product that comes out of South Korea. And I have to say that injecting a potentially deadly neurotoxin into your body when you have no training whatsoever is just a really, really, really bad idea. It is cheap, I will grant you, and Inatox is dirt cheap, but it's not FDA regulated, which brings up the questions of contaminants, risks of infection. You could potentially get a hot vial where the dosage is way high, or get a vial that has none in it whatsoever. And then the fact that you're injecting this deadly neurotoxin into your own body without the proper training and knowledge and technique. And I will tell you that even people who are experienced injectors occasionally have issues, and some of the potential issues that could pop up are the muscles getting paralyzed that you don't want to get paralyzed, so you get like a lazy eye or a droopy mouth. And the biggest risk is death. I mean, Botox is deadly. If you inject this stuff into your bloodstream, it absolutely can kill you. So yeah, I'm gonna have to say that do-it-yourself Botox at home is a super, super bad idea. I get that it's cheap, but not worth the risk in my opinion. So, All right, last segment. You ready? Yeah, this is a good one. This is something we've talked about a lot. There was a recent NBC News article that caught my attention because it talked about a danger that we've talked about many, many times on this show. And so this segment is about Sono Bello specifically, but all plastic surgery chains currently being under fire. And this is an NBC News article, and I'm just going to quote and talk about what the NBC News article talks about, and then I'll just kind of give my own opinion, which is something I've talked about a lot. And this article called out the plastic surgery chains. I call them plastic surgery mills, and so for those who don't know what that means, when you call my office, you're calling to see me, like the doctor is me, and you know that. A plastic surgery chain is where you're calling a business that does a lot of marketing, and you're not really going to see a specific doctor, and oftentimes have no idea who the doctor is that you're going to see.
Right.
So that's the difference. This is corporate plastic surgery. These are big businesses started to open these chains. I like to call them mills, like a puppy mill, but a plastic surgery mill. And they do a lot of marketing, a lot of advertising, and then they hire just pretty much any surgeon to do these procedures.
Yeah.
And it's really sad because the laws allow this. So this NBC article, throw that article up there, Brennan, if anyone wants to look at it. KFF is an NBC affiliate. I can't remember, maybe in Florida. I know this happened in Florida, but I can't remember if that KFF is in Florida. Yeah, right. So a patient named Aaron Schaefer went and had a tummy tuck at Sono Bello in Florida. The surgeon who did it, unbeknownst to her, was an OBGYN, so not a plastic surgeon. And really, and my wife's an OBGYN, so like I'm not gonna, I'm very familiar with what they can and can't do. Like an OBGYN doing a tummy tuck is just so far out of bounds. I mean, that's just, their surgical skills are very specific and do not in any form or fashion include
No,
doing.
I guess they thought they think they can do it because they can do C-sections.
I guess, I don't know. I mean, it's just so sketchy. Anyway, so this patient, Erin Schaefer, had pretty severe complications. In fact, she was in the article, and of course they do these under local anesthesia, which is insanely dangerous because they can't get any anesthesiologists to work with these non-plastic surgeons. So most of these are, almost all of these surgery chains don't use general anesthesia. And the patient was saying that she was in severe pain, felt like she was being skinned alive, and at one point asked them to just stop, and she didn't care if they were finished or not. Like, apparently she just had this horrible experience. Ended up requiring hospitalization, and then she was shocked to find out that her surgeon could not see her in the hospital. Why?
Because she's not a surgeon.
Well, I mean, she's an OBGYN surgeon, but she does not have privileges to see somebody for that particular problem. She is not deemed properly trained, properly certified to treat patients for the problem for which the surgery that she did herself, which is insane. And so, of course, the patients don't realize that when they go in. In fact, I'm involved in some cases that this exact same thing happened because I do that malpractice stuff as an expert. And she ended up being in the hospital for a long time, and then she come to find out that her surgeon was an OBGYN, and of course they're suing the surgeon, they're suing Sono Bello. And this NBC News article kind of took a deep dive into these chains. And so there's Sono Bello is probably one of the bigger ones. Me Aesthetics I've heard of. And there's another one called Goals Aesthetics. And they're all the same. They're plastic surgery chains. They're corporate plastic surgery, lots of marketing dollars to chase patients. And they cut the corners with no anesthesia oftentimes. And then hiring surgeons that are not plastic surgeons and paying them less money. But what's crazy is I was looking at their fees for surgery are the same as like what we would charge.
Yeah.
I always thought that these places were like dirt cheap, and they're really not. I mean, I was looking at what she paid for her surgery, and I was like, that's basically what we charge. So it's not even cheaper. So the NBC News article did a dive into the malpractice suits against these people. And I knew it was going to be big, but I was kind of surprised. So Sono Bello, in the past 10 years, has had over 60 malpractice lawsuits filed against them. And that does include numerous deaths, which is crazy because, realistically, a plastic surgeon should not have a cosmetic death in their career.
Yeah.
I mean, it's possible. Like, if you had one, it'd be like, ooh, that sucks, But like for a chain to have multiple deaths, I mean, that's just unacceptable. Me Aesthetics has had 30 malpractice lawsuits in the past 5 years, so basically the same rate.
Yeah.
And again, like as a plastic surgeon, it does depend on where you practice, but realistically, you probably shouldn't have a malpractice suit against you in your career.
No.
You really shouldn't. I mean, it could happen that somebody may file, a suit that's not really legitimate, because that can happen. But realistically, you shouldn't have one. And so, 30 in 5 years, that's a lot. Gold's Aesthetics has had over 40 malpractice suits in the past 7 years. So there's a lot of lawsuits against these plastic surgery chains. And the worst part, I was reading this in the article, a lot of these places will try to preemptively prevent lawsuits by making people sign waivers that they can't. I mean, there's like a lot of legal jargon in it, but the intent is that it makes it almost impossible to sue them, which some of those things have been declared, not ethical by different, judicial judgments and stuff. But the whole thing is just shady. I mean, basically making a patient sign up. And I don't think a lot of these patients know what they're signing, to be honest.
No.
No, they just get like a stack of papers.
Well, when you see like when you see doctor in front of somebody's name, you're supposed to trust them.
Right. Yeah. No, I agree. And I don't think that the patients are. I don't think it's the patient's responsibility to wade through the technicalities of, one who is, certified to do these things. I mean, they don't know. They have no idea.
It shouldn't even be questioned.
Right. It's the
the
institution
weird
or the
thing about it.
doctor's ethical responsibility to be transparent.
Yeah.
And these places are not. I mean, they're just not transparent about who's doing what, and this whole thing about saying that you can't sue them. I mean, that's crazy. It's just very shady.
Yeah, sounds like it.
So, and we've talked about these plastic surgery chains many times and why they have so many problems. Because, when you look at this list of how many malpractice suits and the numerous deaths, I mean, it's crazy, the number of deaths. And, we talked about that a month or so ago. Remember we talked about Miami and how many deaths they have? Miami's got a ton of these plastic surgery chains.
Well, what chain did that lady that died,
The one that just died? Uh-huh. I don't know. I'll look.
Yeah.
I don't
That's bad.
remember. I don't think
It
it
was
was.
the guy killed that lady, and then he did another
one.
surgery.
Yeah, I'm pretty sure that was.
That's like manslaughter.
Yeah, right. I mean, 2 in 1 week. That's insane. I don't remember, but it wasn't one of these big 3. These 3, Sono Bello, Me Aesthetics, and Goals, are pretty big. They have.
I've never heard of them, to be honest.
I know of them through.
Is there one in Dallas?
I know of them through the legal world.
Ew.
Yeah, they do have. They have.
So Dallas has plastic surgeons there that aren't really plastic surgeons. Ew.
Yeah, I told you this is a huge problem.
Freaking Wild West over here.
one time
Plastic surgery world.
It is, because the laws are too loose. They need to be fixed. But one time, and this is about 10 years ago, I used to have this assistant, a social media assistant, and I said, I want you to pull up every facility in Dallas-Fort Worth that offers plastic surgery services, okay? And I want you to give me their websites. And so he did that. And then I went to every single, it was 400 or something. It was a lot. And I went to every single one, and it was something like 20 or 25% of them had a surgeon that was not a plastic surgeon. Yeah, it was pretty high.
It's what is this? Your hobby?
I was pretty shocked to find that. Well, I mean, we talk about this all the time. It's a problem.
I know, but you never think it's.
Yeah, you never think it's real.
I mean, it's come on, Dallas.
No, it's everywhere. Yeah, it's totally everywhere.
It seems like it would just be in sketchy places like
Florida. We always talk on Florida.
Down in them swamps out there.
So, and we've talked about why these places have so many problems. I mean, 2 big reasons, in my opinion. One, a lot of these places, I would say most of them, almost all, are not using plastic surgeons. They're using non-plastic surgeons that might be an OBGYN, an oral surgeon, a general surgeon, an ENT doctor, people that are not trained in plastic surgery to do plastic surgery procedures.
It's weird.
I mean, and they try to skirt it by saying, oh, we sent these people off to get training. I mean, it's a joke. It's not any type of regulated training. They'll send somebody to go watch a couple surgeries, and they're like, all right, get out there, champ, and do
How crazy. You go to your appointment, and the doctor's like, hi, I'm your oral surgeon here to
They don't say that. They say
here to do your boob job today.
They don't say that.
It'll say but that's what they're doing.
It'll say cosmetic surgeon on their jacket. They can't say plastic surgeon because that's fraudulent. Because plastic surgeon's a real thing, but cosmetic surgeon's not a real thing. There's no such thing as a cosmetic surgeon.
Yeah.
I mean, there's no cosmetic surgery, board. I mean, there is, but it's like a non-regulated board.
Plastic catfishes.
Doesn't mean, yes, exactly right. So, when you do these major surgeries and you're not properly trained to do them, and then you have the added stress of you're doing these under local. I would never, and I mean never, do a tummy tuck under local. It is absolutely insane.
That is insane.
I don't think I've done 1,000 tummy tucks, but I've done like 700 or 800.
That's like a serious surgery.
I mean, I've done as many tummy tucks as almost anyone out there. Very, very skilled. I did one, this morning. I would never do one under local. That is just so insane to do that, and yet these places do it all the time. It's just absolutely mind-boggling. And now it's I don't even understand why people go to these places, because I always used to think that that they were so much cheaper, but I don't think they are anymore.
Yeah.
I think the prices have basically become equivocal to going to a legit plastic surgeon, but it's all marketing. You know, they have great websites,
Yeah.
great marketing blitzes. You know, they're very effective at relaying a message of, you know, how great this is.
Yeah.
And
It sounds like people are just paying for a shiny, nice brand
yeah, I think so.
and not really getting.
But you know, things like this
Quality.
NBC News article. I mean, enough of these things come out, and I think patients will hopefully, and you know, and things like us, you know, people talking about it. You know, it's just not safe. I mean, you know, that number of lawsuits, that number of deaths, that is a stark difference from plastic surgeons that are
Honestly,
properly
with
trained.
like all medical services that are franchised like that, stay away from them.
Yeah.
Like even like dentist office that are franchised, like Mint Dentistry, like that place. I went there one time, like
Not
I
a good
don't know.
experience.
a long time ago, like
Yeah.
right when Avery was a baby, and they tried to do, like within one sitting, they did like 6 fillings in my mouth.
Jeez, that sounds like a lot.
Yeah, it was so like uncomfortable and horrible, and I had never had any cavities before that.
That's weird.
Exactly.
That's very weird.
So I think they just did all of that, charged my insurance, sent me on my way, and I had to go to like a normal like
Regular dentist.
like one person owned dentist office, like a family dentist office, and I never get fillings.
I
Ever.
definitely agree with you that like doing some sort of corporate medicine is a bad idea. I mean, you want to go, you know, for procedures, you want to go to somebody that you know who they are. You can research them.
Yeah.
You know, you can check their background, check their training. You know, see their befores and afters, and you know these chains like that's not that.
Yeah,
Like,
well, it's like when you go to your office, you're putting your name on somebody. As soon
exactly.
as they walk out the door, like
Yeah.
you have your name on them.
Yeah.
That's your work.
Right.
With
Yeah.
everybody else,
It's
like,
scary. I mean, I don't know. We'll see. I don't know if anything will turn up. You know, these every once in a while you'll see some news agency, you know, talk about these places, and it gets a little buzz, and then it dies off, and then something
Yeah.
else bad happens, and then we talk about it again, and nothing really changes. It's just terrible. But I don't know what to say. All right. Brandon, let's recap this. Today we were talking about the plastic surgery chains being under fire. Yeah, places like Sono Bello, Me Aesthetics, and what was the other one? Renew, I can't remember the name of it. Oh, Goals Aesthetics. So these are corporate plastic surgery where it's not going to see a specific doctor. It's corporate medicine. It is high marketing to get people in, and the person that's doing your surgery is just kind of someone that they hire for the day. And the problem is that oftentimes these people doing your surgery are, and I say often, like almost all the time, they're not plastic surgeons. They are OBGYNs or general surgeons or oral surgeons or ENT doctors. And there was a recent article by NBC talking about these plastic surgery chains and how many problems they've had from a legal standpoint over the past however many years. They were talking about Sono Bello and Mia and Goals, and talking about that they had 60 malpractice lawsuits in the last 10 years and 30 lawsuits in the last 5 years and 40 in the last 7 years. And this included numerous deaths. And we were talking about how a normal plastic surgeon would not have anything close to that from a legal or especially a death standpoint. So the article was actually pretty interesting. It went into a lot of detail, a lot of stuff I didn't even know, and we talk about these plastic surgery chains all the time. So what does this mean? Probably nothing. Unfortunately, the laws are too loose to actually do anything about this. And so, you'll see a news article about somebody getting, hurt or killed at a plastic surgery chain. People talk about it for a while, nothing happens, it dies off, and the whole cycle repeats. But we are here to try to educate people about what the dangers are of doing that. And I just think that if you're going to do something like surgery, avoiding corporate medicine and plastic surgery chains is a very, very good idea. So there you go. I think that's about it.
Yeah.
About all the time we got for today.
We got one more comment.
Oh, yeah, more. One more.
Surgeons sound like a podcast or Netflix special waiting to happen. Oh, wait, sorry, I missed the first. Fake corporate plastic surgeons.
Fake corporate plastic surgeons, yeah. Yeah, I mean, we talk about it all the time here on the show, and I mean, people watch, I guess, and hopefully, maybe
Yeah, they should call it catfish surgeons.
Yes.
Catfish
I would
sur-
tune in.
catfish surgeons.
Yeah.
It is a problem, and I am glad to see, because now that's 2 malpractice suits that we've talked about in the last 2 weeks, where the plaintiff felt like that they were deceived, believing their surgeon to be properly trained plastic surgeon, and that's like the emphasis of their lawsuit. And in fact, I, as I've said in the past, do a lot of malpractice consulting for plaintiffs. I have a couple like that going right now, where the patient believed their surgeon to be properly trained and they weren't.
We need to find an investigative reporter.
Yeah. Okay.
My cousin is.
Oh, really? Oh,
Yeah.
we should do a
For
collab.
like a good news station, I think, in Dallas. I don't know what it is, but she's an
Do
investigative
call her up,
reporter.
man. Is it he or she?
It's a girl.
Call her up. Let's do a segment.
She probably would.
Do call
to
her.
be honest. She
All
does
right.
criminal ones.
Call her up, man. Let's talk.
Yeah.
Let's blow the lid off this
I
thing.
should.
Do it. I want a full report next week, Sarah.
Okay. I prefer real Will.
Okay. For real, I'm gonna ask you about
I'm
it.
like, have you ever investigated fake surgeons and plastic
Yes.
surgery?
Dude, tell her that
Say.
we got an insider, me, that can
Yeah,
explain it
because
all.
you do all those malpractice
Yeah.
consultation things or
Yeah.
whatever it is.
Yeah, well, that might be interesting. All right. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button and leave us a comment. We want to know what you want us to talk about on the next episode of Nip Talk. See you next week.
Bye.